So I'm Dr. Curtis Adams, and I do hip and knee replacements here at Shine Regional. So the anterior approach is essentially a minimally invasive approach to the hip. And instead of some of the traditional approaches, which involve cutting more muscle, then the anterior approach spreads between the muscles, and it's a smaller incision on the front side of the hip, get down to the hip capsule, and then replace the hip. And I've seen a lot of patients do really well after an anterior hip, primarily getting back on their feet quicker, having less pain, and recovering quicker. And that's why I'm really excited about bringing this approach to the community here. One of the real beauties of the anterior approach is getting patients back on their feet quicker post-operatively. I like to have patients walking the same day as surgery. And typically, most of my patients talk about being able to get back to most of their activities within a few weeks of surgery. If they're using a cane or walker beforehand, I'd like to see them back to that post-operatively and ideally improving their function as they work with physical therapy. One of the advantages of the anterior approach is a lower risk of dislocation. So it's a very stable approach to the hip. And in terms of precautions, really don't have anything that patients can't do post-operatively for fear of dislocation. Any kind of hip revision means there's been some hip prosthesis put in. So there's been a hip replacement or hardware put in the hip, and the hip is worn out, the hardware's failed, something's happened, so the hip is painful, or the patient is disabled. And essentially, hip revision means going back in and replacing that painful hip with more or better hardware. I think anytime you've had a hip or knee replacement and over the months to years following it's become painful, unstable, someone's potentially had a trauma, so they've fractured around it, something like that, and they come to the clinic and essentially they're having disability or pain, then it's worth looking into getting some x-rays, some other scans and tests and seeing, does this need to be revised, or is there anything else that we need to do to correct a potential problem?